Good afternoon. It's Wednesday, August 13th, 2025, and we're here this afternoon for a work session. Our discussion item is Performance Measures for Human and Economic Health. I'm Kristen Stevens, Chair of the Board of County Commissioners. With me are my fellow commissioners, Commissioner Jody Shattuck McNally and Commissioner John Kafalis. We have our County Manager, Lorinda Volker, with us. We have a whole table full of wonderful people. But I won't take the time to introduce everybody. I'll let folks introduce themselves as they speak, but I will introduce Julie Elser, our Data Program Manager, to kick us off and get us going on these performance measures. So welcome. We have a lot to get through, and I think we have an hour, so we'll get going. Thank you.
Sounds good. Thank you. I'm Julie Elser, Data Program Manager. Today is the third in our series of performance measures presentations. Human and Economic Health Service Area is presenting today. And as was mentioned, we do have 1 hour today, so we're going to just dive right in. We have about 10 to 12 minutes per department. We'll try to stick to that. And to make up for Human Services always going last and being rushed at the end, we're going to go backwards, and we're going to start with Human Services and work our way up. So with that, I'll go ahead and turn it over to Human Services.
Thank you. Heather O'Hare, Human Services Director. And with 10 to 12 minutes, I'm still going to rush myself. So, but these are the measures that we've presented to you all for several years now. We did not make changes for this year, so hopefully this will be a refresher. So 3 of the 5 are child welfare related, and then the remaining 2 are child support related. So I'll start on the far left. This measure is looking at the percentage of children that become re-involved with child welfare after we close their case. So it's looking at a 6-month window from the time of case closure. And what we hope to see is very high 90s. 97% is the federal goal. We like to be as close to 100% as we possibly can. When a family becomes involved with us and we've wrapped up our services, we hope that they never have future involvement. So that's really what this is tracking. So for 2024, we were at 98%, relatively the same as 2023, and something that we just track very closely as the services and case types. A lot goes into what can result in a child becoming re-involved with us. So this is a measure that we watch closely throughout the year. I will shift to the other child welfare measures, and then I'll come back to the child support just so that we're keeping with the same program and generally the same population. So there on the bottom, you have 2 measures that are put into one graph. I'll actually talk about the green first on the right side, and then switch over and talk about the left side there that's more in the tan. So the right side here, this is looking at within our cases, how many of the children stay in their home, in their family of origin during the time of our involvement. So this is really looking at those in-home services. How are we doing with trying to prevent foster care, kinship care, or having to remove that child from the situation? And you can see it has been a steady decrease over the last several years. And that's really, there's a lot of reasons for that. One, the severity of the safety concerns continue to increase, significant substance use, significant domestic violence, things that impact a child's safety in the moment that we can't always provide services around to keep that child safely home, but also really trying to manage as the cost of providing in-home services has just continued to increase significantly. So we do see fewer children. We're down to 83%, which is the lowest that we've been for several years as far as we've tracked it here on this graph, with more children entering foster care or kinship care during the course of our involvement. Then switching to the left side, and the reason I wanted to cover this second is this is really further along the continuum. So for the children that enter foster and kinship care, there on the right graph, what the left is looking at is the percent of children then that stay home after they return home. So once we are closing their out-of-home placement, whether that's foster care or kinship care, and they're returning to home or to their permanency placement, do they then re-enter out-of-home care in the following 12 months? And so that's what this left side is measuring, is later in that child's life, does the child come back into care within the next 12 months? And so while we see more children entering out-of-home care based on the graph on the right, what we see is actually a pretty significant increase that once that child goes home, they don't re-enter care. So while we always want to keep the child home and not to enter foster care or kinship care because it's very traumatic, once we are returning that child home, we see 95% of those children stay home and aren't re-entering care. So we are doing something right when we are having to intervene in that family's life to that level. And so, again, another measure that we track, all three of these are actually federal measures that we track very closely. I'll cover the last two, which are child support. The top graph is looking at the child support collected for every dollar that we spend on administrative or programmatic costs. We have stayed relatively flat in the amount of child support that we collect. We have significant dollars that we collect, upwards of 19 million every year that we collect in child support and then goes back out to the custodial parent to help care for those kids. But as our costs have increased to administer the program, you see that ratio changing. And so as we've made changes to personnel, it really is the bulk of the program costs are the personnel related costs. This is a team of roughly 35 staff. And so as we change pay for employees, it offsets this measure a bit. So that's why you see the continued decline. We are seeing it tick back up in 2024, but we've been holding on a couple of vacancies as we reassess caseloads and try to figure out what is the best caseload for this program. And then the last graph there on the far right is showing the percentage of cases where we are collecting child support. So what I'll also mention is that in 23 and 24, we also added a very specialized position to this team to help reduce barriers for non-custodial parents that are required to pay child support. Sometimes they have employment barriers, sometimes they don't have income, they don't have the means to pay their child support. And so we do have a specialized case manager that we've added to the team to help reduce those barriers and figure out what is the barrier to paying child support. So we're hoping that we will see that tick back up in the percent of cases where we're collecting child support then to be above the 65% goal. But again, the 63% that we collected in 2024 was roughly close to 19 million over the course of the calendar year that was collected and then redistributed back out to those families.
Thank you. Commissioner Cavallo has a question.
Yes, thank you. Thank you, Madam Chair. Thanks, Heather. I have three questions but for each area, but we may not have time. Going back to child welfare for a moment, what is the average amount of time that a child and a family are receiving child welfare services, either if they're in-home or in out-of-home placements?
When for out-of-home placements, children are generally in out-of-home less than a year. For in-home services, though, it's a really wide range, but I can get back to you with that data. But children are generally in out-of-home less than 12 months.
May I go to my second question?
Sure.
Okay.
Knowing that we're,
Okay. Maybe I'll hold off on my third question. I'm looking at Julie. My second question, I think, is easy, but you mentioned that the ratio regarding child support collected for every dollar spent, I thought you mentioned that the main cost driver was salaries? Are there other cost drivers that are affecting that ratio?
No, not really. There's facilities costs, there's other minimal overhead, but the team itself is 35 FTE, so it really, the personnel costs are the most significant driver.
So it's the attempt to pay a reasonable salary to keep folks doing the work? I mean, we're trying to pay decent salaries, and that's gone up with cost of living and everything else.
This is also a tricky program in that this is our highest county match requirement. The county is required to contribute 34% into this budget, and then the rest is state and federal. So the county's portion of the budget is the highest percentage compared to any other program too.
Okay, great. I'll stop there, Madam Chair. I do have one more, though.
Just, this should be a fast question, but if we don't hit those federal goals around, child protection kind of situations, are there any penalties?
In child welfare, not necessarily. I guess the state could look at fiscal sanctions, but it's never happened before. In the child support measure, though, there is a very direct fiscal consequence. We get incentive dollars for that measure there on the top, the administrative costs. So we use then those incentive dollars to offset the county match. So we do see our incentive payments year over year sort of ebb and flow as this measure changes.
Thank you. Thanks for explaining that. Okay, I think we'll keep moving. Is that fine? Do you have questions? Okay. Thank you, Heather.
Madam Chair, I just wanted to ask if we did have maybe questions, but with time sensitive, or would we be able to just, would Laura like us to send them to Laura or to, all right, just wanted to say that. Thank you.
All right, Julie, next department.
All right, next is health.
Good afternoon, Commissioners and County Manager Volker. Tom Gonzalez, Public Health Director. I do have with us here today Dr. Jared Olson, our Senior Population Epidemiologist, who handles all of our data and performance measures. We did make some changes this year, and it's based on health and environment. We are required to align our work with the Colorado Foundational Public Health Services as defined through the Colorado Board of Health and our governing board, the Larimer County Board of Health. These standards serve as a framework for how public health is delivered across the state and ensure that every local public health agency provides consistent and comprehensive set of core public health services. So guided by these foundational services, we are focused on addressing our core competencies and making sure every Larimer County resident has an opportunity to live a healthy life. We support this by Jared working with our managers to identify 5 key measures that reflect the work of the agency and our commitment to keeping the community safe and healthy. These measures will include disease investigation and prevention, food security and nutrition for our children, clinical care and immunization, environmental health, predominantly food safety, air and water quality, and public health communication. So each of these areas represent a vital function of our role in protecting and promoting community health and are in those Colorado foundations for public health services. So with that, our first indicator, I'll turn it over to Jared, is he's the one that's been working hard on this one.
Thank you. Jared Olson, Senior Population Epidemiologist. So the one we're referring to here is the bottom middle graph, and it refers to both the number of uninsured children in Larimer County as well as the number of vaccinations that our clinics, predominantly in Loveland and in Fort Collins, but also remote clinics, provide to children under the age of 19. So our clinical services provide a core necessary function for a small but vulnerable group of uninsured and typically Medicaid receiving families through the Vaccines for Children program, but also through sliding scale. So typically what we have seen is for every about two uninsured children in Larimer County, we are providing one immunization or one vaccination. I should note all of these vaccinations are non-COVID. Counting COVID ones would have skewed some of those earlier years, and we're holding steady at that from 2 to 1.8 in the last few years.
Our next performance measure is really reflecting on our goal to be fast, the most accurate and most trusted source the community turns to when public health information, especially during a public health crisis. In 2024, we issued 20 news releases, next door alerts, and health alerts to keep our community informed and prepared. These include everything from a neighborhood-specific rabies warning that recently happened in Loveland, shared on Nextdoor, to urgent health networks notifications that reflect local healthcare providers responding to emergency communicable diseases such as measles, and then to countywide advisories for public health threats such as West Nile virus. So all these cases, we want to ensure our messaging is clear, timely, and accessible to all residents, because effective communication is essential when it comes to public health, and it's part of what's called Public Health 3.0 as we're moving to be more health strategists. So we're really going to reflect on the communications piece on that over time. This will be one of those that it's more of a story than really just the number. So we look forward to adopting this into our performance measures in our upcoming years. Our next one is the middle top one. We continue to work with our consumers and our operators at over 2,000 licensed retail food establishments. That includes restaurants, cafeterias, mobile trucks, et cetera. In 2024, we maintained a strong focus on food safety with fewer than 2.75 foodborne illness risk factor violations per inspection. That's a key indicator of compliance and prevention. We also prioritized oversight of high-risk establishments, completing 93% of the required inspections at these locations. We say high risk, they have more cook, cool, more steps that could lead to a foodborne illness. They're usually your full-service restaurants. The targeted approach helps us ensure not only safe food to serve, but also strengthens our public confidence in our local food businesses. Importantly, our data shows that retail food establishments with 3 or more foodborne illness risk factors at the time represent a significant risk of foodborne illness. In fact, most foodborne illnesses, when investigated, there's usually 3 to 4 of those. So we want to keep that under 3, and our goal is 2.75, and last year we were running right at 2.3, so we're proud to know that we've got a really strong food protection program, and the compliance with the industry is strong, so it's a good collaborative approach. Our next one is working on communicable disease and preventing the spread of communicable disease in our county. And despite an uphill challenge to have folks answer unknown phone numbers or answer the phone calls from our communicable disease team, we completed 88% of the required communicable disease interviews in 2024, well above the 80% that the Colorado Department of Public Health and Environment, our grant with them, that's the goal. These interviews are a critical part of the disease control efforts. You all learned through COVID, contact tracing, getting information on whether they need treatment or et cetera. Maybe they need a quarantine, isolate. All of that helps to prevent the further spread of communicable diseases and protect the broader community. And typically, we see most of this work within our child care centers, our long-term care centers, any of those centers where they're higher risk. So that's a goal that we're monitoring on our communicable disease. Lastly, but certainly not last, is our continued insurance that our families have access to necessary food benefits, education on nutrition, and reducing food insecurity in our communities. The WIC program, despite federal cuts and an expanded workload of additional families in Larimer County, over in the last 3 years, we've seen an increase of 24% to over 4,000 participants in our WIC program. We continue to ensure that families have the benefits when they go to the grocery store or the farmer's market every month. Because WIC requires monthly meetings to maintain benefits, it's essential that WIC educators have the time and space to meet with the families. And in 2024, they maintain a 22% of eligibility for that, which is up from 91%, and the federal goal is 90%. I will send a big thank you for the Board of County Commissioners helping us with the waiver on the indirect, because there's no way if we pull a position in that program, we will be able to make the 90%. And what happens then is we have kiddos on wait lists that aren't eligible at that time to receive the WIC benefits. And those are our kids that are not in school yet, so they're not getting the free breakfast and lunch. So it's usually like your 3 and 4-year-olds that are the higher risk. And that's our report.
Thank you. Any questions? Commissioner Fallis?
Thank you, Tom. Thank you, Jared. Regarding the number of public health alerts issued, that number 20, I imagine, does not include air quality alerts. And so what institution is responsible for issuing the air quality alerts that show up on our phones? And how many have there been so far this summer?
Yeah,
Seems
thank
like
you for the
We've gotten
question.
quite a few.
Yeah, thank you for the question, Commissioner. The actual quality alert, those come from CDPHE, Colorado Department of Public Health and Environment. We get those, and as soon as we see anything that leads to a detrimental health issue, we'll release a release on our behalf. We did that last week when our air quality index got up above 150 because of the imported wildfire smoke and the ground level ozone. 150 means it's impactful to anybody, not just sensitive people. So we made sure we were communicating with our superintendents, our schools, our childcare centers regarding outside activities such as sports that limit that because of the risk.
Thank you. And I think subsequent, it would be helpful to know what is the trend that we're seeing over the last couple of years as it relates to air quality alerts and as it relates to high temperatures. And so that would be helpful if we could, I don't know how easy it is to gather that information from CDPH.
I don't think that'd be too hard, would it, Jared?
Nope. Some of that information is already available on a health and well-being dashboard, including the relationship between our highest temperature days and our high ozone days. Those are not typically correlated with our wildfire smoke days, our PM 2.5 particulate days, just because those are so dependent on weather patterns and where there are other fires. So this year was Utah and Arizona. Previously, it's been Wyoming. We've caught some of the Canadian wildfires in prior years too. Obviously, our big fire years with East Troublesome and Cameron Peak were significant as well. We do monitor ozone, which is much more local and regional. I do have that just because that was a health indicator on the previous dashboard. I do have that if you'd like to see those. The overall trend with the addition of the Tinmouth. I'm sorry, we can't reach it, huh? Again, that is also available on the website. But the overall trend with the Tinmouth monitor now included is we are exceeding that 70 parts per billion threshold that the EPA has set for ozone, ground level ozone, as a pollutant and as a air quality risk. So, it's been variable based on the weather and based on other factors, but the overall trend is not particularly promising. A lot of the factors that go into this, both the heat as well as the precursors, don't appear to be changing trends, though it's going to change year to year depending on the heat of the summer.
I was just noticing that the school district is already, as related to heat advisories, are doing early release on the first 2 days of school. Thank you.
Thank you. Commissioner Shannock McNally.
Thank you, Madam Chair. And this may be a parking lot question, but I know we're short on time. And maybe you would mention this, I guess I'm directing this question to Dr. Olson, if that would be okay. And maybe you said this and I didn't catch it. Lots of things happening today. When we talk about the vaccination rates, we're looking at 2024, and it was at 1.9, and you mentioned that some conditions or uncertainties have entered 2025 with rates of vaccination, especially when it comes to measles and some of the outbreaks, and maybe that was already asked. Are you, so my concern is, as we're looking and going forward, and I know we don't have numbers from 2025, but are you seeing any trends already, or looking at numbers or tracking if we are seeing kind of, or maybe this is for the director as well, where we're seeing kind of a change in numbers from 2024 to today that might be of concern for our overall public health. Thank you.
So I think the bigger concern in our county, so obviously there are measles concerns nationally, especially in pockets that are predominantly unvaccinated or undervaccinated. Our county, and this is the bottom graph on here for our overall, right? We don't have much influence as a clinic staff on this number, except for our most vulnerable uninsured population. But overall, we're pretty steady around 90%. And that's true for the majority of our child gathering areas too, right? Most of our schools and our child cares are pretty well vaccinated to very well vaccinated. There are some schools and some less so child cares, but there are some schools that are less vaccinated than ideal. And those are ones we are paying attention to and working with a communicable disease team to be prepared for, as well as to educate and support those schools.
I would add too, real quick, I'm real proud of the clinical team looking at this through an equity lens, and we have a plan to take the back-to-school immunization on the road. We're providing 22 off-site clinics throughout the Larimer County in the next month and a half. So that's way up. We used to do 5 or 6. We know we need to get to community. So hopefully we can improve those numbers.
Thank you.
Yeah, thank you, Tom and Jared. Really great information here. I'll just throw something out, and this is a question that will likely have to be answered later and in more detail. But as we face, people being moved off Medicaid, what does that look like for you? Are there ways that you plan to ramp up? And, maybe people can't see a pediatrician as often, but they still can get their immunizations. And so, there again, this is sort of a forward-looking kind of thing, but, how do we prepare for what could be a situation where people lose both Medicaid benefits and some food benefits? And how can we, put some, something under that so we can kind of protect and take care of as many people as we possibly can?
Yeah, thank you for that question. That's a very important question. Jared's been providing data and trends where the current number of those that are not insured to where we projected over the next 2.5 years as that bill kind of unrolls, that could get us up into the 55,000. That would get us prior to the Medicaid expansion. And so we're looking at what we were doing prior to that. Yes, our clinics, especially family planning, which is a prevention program, cervical cancer, pregnancy tests, STIs, those things. That clinic used to be much more busy than it used to be, which was a good thing it wasn't, because people had medical homes. So we're looking at how are we going to ramp that up with perhaps Title $10 getting reduced. So that's going to be a conundrum, and we are engaging the Board of Health already and starting those conversations now, but we will need to address that over the next year to 2 years.
And kind of looking at Heather, she's got some of the similar kind of situations going on, is that, she's, how do we still serve as many people as we possibly can under the current, under really changing guidelines?
It's really going to take us to be creative and working with our FQHCs, such as Sunrise Salute, our other health clinics, really come together and talk about where are the gaps and who can take certain gaps. It's going to be, I think that's exciting. We can collaborate even more, but it's going to take us to get together and really look at this holistically.
I would just add really quickly, we were just notified last week that we received some grant funds from Healthcare Policy and Financing to actually convene a community group to start talking about where are the existing Medicaid gaps and how can we pivot with what we know that's coming. So Tom and his team will certainly be included in that, and we're just pulling that together right now.
Thank you. That's really helpful. I'm glad we're thinking about that before it actually happens, so we can at least sort of have a plan going forward. Wonderful. Well, we'll move on to then the next department. Thanks, Julie.
All right, up next is Extension.
Okay. that on? Okay. Hi, everyone. Carrie Weiner, Larimer County Extension Director. Thanks for the opportunity to talk about our work in the community. Appreciate the work of my colleagues in Health and Human Services. Incredible work. So going to take you on a little bit of a different path with our work and highlight a few new performance measures as well as one that's been consistent, and I'll try to provide a little context for you to understand with the new ones. We have some historical data that we're able to provide as well. So as you know, we do a wide range of programming, everything from gardens to farmers markets to 4-H youth development to food safety, agriculture, natural resources. And so we're just highlighting a few of our efforts here today. The first one I'll highlight is the number of educational contacts made by our Master Gardener volunteers. You can see what could be an exciting positive trend, but I just want to temper that by saying it is a positive trend. We've made a lot of educational contacts in the community. This year, we didn't accept any more Master Gardener volunteers. We have 125, and there's some capacity that we hit there in our ability to take on and manage more volunteers. So positive trend. I just don't want to set up an expectation that it's going to continue at this seeming exponential kind of rate in the future. And I also just want to remind folks, people enjoy calling our office to help them out with their lawn issues, their tree issues, their garden issues, and that's great. And also just remind everyone that the impacts that they have, their goal is to reduce the use of unnecessary inputs. So meaning like reduce water use, reduce pesticide use, reduce fertilizer use so it's appropriate. And so there are some beneficial environmental impacts that result from the work of the Master Gardeners beyond just the fact that they're making contacts. And I just wanted to highlight that. With respect to the farmers market, again, like really positive and very similar story that I would share there of we're really happy with the growth. We previously had a goal of $700,000 a year in annual sales. And this last year we upped that to 1.5 because we feel like that's where we've been and that's where we can probably maintain. But it's also not gonna just, there's only so many people that can fit in our parking lot and there's only so many vendors. So I also just want to temper expectations for the future. I think we're probably approaching, some limits, some upper limits there, but our new market manager is doing a fantastic job. Our whole team is doing a fantastic job. We're bringing on new agricultural vendors who are new and beginning farmers. So it's one way that we're supporting the agricultural community and the continued new entrance into agriculture in Larimer County is through the farmers market and giving them an ability to sell their products there. We had previously highlighted the SNAP dollars spent, and Tom referenced we also allow for WIC purchases at the market. And we didn't report on that this year, but those numbers are similar but a little bit down compared to previous years, and that I think just follows like overall national trends in terms of SNAP dollars that are available. But we're very supportive of SNAP, WIC, our Market Days program for older adults, and all sorts of efforts to make local food more accessible to vulnerable populations. Just moving across on the right there, number of 4-H projects completed. That's actually our first downward trend I'd point to. But it's hard to know. I asked the team, it's a little bit hard to know if this is just kind of natural noise. We did have like our largest club split up this last year, and there was some theories about how they captured project completion information and how maybe now it's kind of they're using, folks are using a different methodology to capture that. But it's something that we're looking at, and we actually have a fair number of efforts directed at making sure that once a kid starts a project that they complete it. So I'll just describe a little bit of that. This past year, we held project orientations for all projects. Previously, we had only done that for our livestock families. We've included some more detailed information for our club leaders on what a completed project looks like. Next year, we're going to break up some project orientations based on age so that our youngest kids and their families can be supported at a level that they need information. And then there's also ways to complete projects even if they don't enter county fair, and providing that kind of reminder and support to families as well. So we're attentive to this, and we are happy to report that we did have a slight growth in the number of youth enrolled in 4-H in this last year. We're at 865. It's the second largest program in the state. We have over 200 volunteers, so it continues to be a very strong program. And then our last one on the bottom is a brand new measure for which we don't actually have like historical data year to year to compare, but just wanted to highlight a program area that we hadn't highlighted in the past around food safety. And I know Tom mentioned his department's food safety efforts, and we have a nice partnership with the Department of Health around our retail food safety training programs, and grateful for that partnership. This figure actually only encompasses like the home food safety programs that we do. So food preservation, it's really important. We have a strong community of individuals who like to can things and pickle things and dehydrate things, and you don't want to mess that up. So that's the kind of education that we provide. And so that number, 90%, reflects those home food safety efforts and just the amount of people that we were able to survey, a little under 300 in the last year who attended our programs. And that's where I'll stop.
Thank you, Carrie. Questions? Commissioner Shattuck McNally?
Thank you. First, thank you for the report. And I just want to tell you, I was able to visit some farmers markets in Albemarle County and Chesterfield County in Virginia over the weekend. That was on the bucket list of the people who I was visiting, and so we traveled through some of those, and I proudly just explained how lucky we are in Larimer County just to have this outstanding farmers market, and the variety and the energy there. So I just want to say I keep looking for something similar, and it's great to visit them all. They're all different, but I just want to say it's still an outstanding and very, very wonderful farmers market. And I appreciate all the things you do, and I'm really interested in that soil health taste test again next year. Would love to be invited. I think that's great. Also, I wanted to just curious about the youth 4-H projects. And we got out of a Forest Health Council meeting where we talked about, I was pushing again the bill that we were looking at trying to get forestry and stewardship. That was brought up again in this statewide meeting, and talking with some outside organizations and trying to get youth exposed to, wildfire and smoke and all these other things, and it's kind of becoming a landscape. So I would love to have a conversation with you. But talking with some the 4-H youth and looking at those completed projects, do you guys track how many overall 4-H individuals and across the county? Are there any areas that could maybe use we could recruit some more 4-H leaders or folks to expand the other parts of the county that maybe don't have as strong of a presence? And then I have one other comment after that. Thank you.
Yeah, thank you for your support of the farmers market. And yeah, as far as 4-H, we do know where our families are coming from. And for example, like Estes Park doesn't have participation. So that's something that we've talked about with the team, is how do we do some recruitment there. And so that's on our radar, and we can continue to keep that on our radar. I think we're doing a decent job in other parts of the county, and we have our open house every fall in Loveland at the ranch. We have talked about reaching out more to Wellington as well, but we have some good participation from families up north and in that area. So that's something that, we track, and we can continue to keep our eye on.
Well, I was definitely thinking about Estes Park, so
Yeah.
if I can help with those efforts, I would love to help you recruit. I know probably some volunteers who need some some activities for their idle hands that have recently retired. So would love to and give them a wonderful opportunity to give back. So, and I wanted to thank you. I did receive a wonderful little note of a bookmark that was watercolor painted in my favorite color. So I don't know if that was intentional, but the nice note from the young lady was really heartfelt. And I know sometimes we get those things and they are meaningful. So I wanted to express whoever encourages that. We do look and read those, and they're very nice to receive, so thank you.
Good, appreciate that.
Thank you. Commissioner Cross, any questions?
I do not have any questions.
I do not either. Thank you, Carrie.
Thank you.
I'm pretty familiar with your work and very supportive, so
Yes, I
thank you.
appreciate all your support. Thank you.
Too.
Okay, next we have Economic and Workforce Development.
Good afternoon, everybody. Mark Johnston. I'm Larimer County's Economic and Workforce Development Director. And Amy, I'm looking at you down the table. I'll split you our remaining time. So Julie, would love for you to give me the 2-minute sign. Coming in today, I chose to focus on 3 of our 5 measures that we've been talking about. So these are measures, as you can see, that have been with us over the years. And I wanted to focus on one related to a federal investment and one to a county investment. So the first, under the Workforce Innovation and Opportunity Act, this is what I commonly refer to as the public workforce system. 2 of these particular measures stand out. But a titch of context before I jump in. 10,000 Larimer County residents served last year. 4,000 raised their hand for more of those 10,000. That more was deeper staff-directed services, and then another 300 raised both hands in an eligibility kind of based program that we call the Dislocated Worker Program. 2 of these measures are those particular double hand raisers, and these are folks who are commonly in our community laid off. These are our federal workers. These are private employees who've lost their job due to no fault of their own. So in the middle there, you can see the most recent cohort. One of the 5 measures, 2 that I have illustrated today, is the median earnings. So of those that we provide services to after they find employment, we literally stack up the cohort. So let's say 100, and the 50th person is that median earnings wage. So as we can see here, looks like little over $12,000 quarterly. It's close to about a $50,000 annual wage. So you can see that kind of has fluctuated over the years, but it puts us well within range of our Colorado report. That's important for us, our grade report. We exceeded that expectation this year. Off to the right margin, you can see the second employment retention. So it matters in our grade report for people to stay working. It's one thing to find work, but staying working second quarter and fourth quarter after you leave us. So this is a quarter 2. And we can actually see we saw a dip there. Pretty sizable dip. I'd round up to 71%, but I think it's 70.6%. I have a handful of hypotheses around that. I do think this cohort, we saw some characteristic shifts of people being served, more barriers. Another hypothesis is a growing gig economy. How we track entered employment is through unemployment insurance records. When you're a contract worker, when you're a gig worker, now we don't have that tool any longer, so people have to self-report to us. And frankly, it's becoming harder and harder for people to verify that for us. So those would be the 2 there. What I would also say, but hypotheses are only, educated estimates, guesses. So I did want to illustrate, we have staff upstairs on the 5th floor. who are busy working with Northern Illinois University's data research and evaluation group to build stronger evaluation ties. I'm also sitting next to Julie, who is an internal county asset that, as a matter of fact, we have a meeting this Friday where we will begin to uncover some new internal partnerships around really understanding the evidence around that particular measure, and frankly, all of our measures. Off to the left is more of an outcome out of our economic development office, scope of work that the county makes an investment into. And I just kind of opening, remind folks, Northern Colorado, we belong to the Regional Economic Development Initiative. You'll hear that acronym READY. It recognizes really that economic benefits in one community benefit all through an interconnected nature of regional work. Why that's important for this is Larimer County is the tip of the spear in partnership with a partner in Weld County, where businesses who hire site selectors, attraction firms, send RFPs our way, and then we collect that information. So imagine I need a facility this large. It has to have this kind of water, this kind of power. It needs to be close to this, rail, et cetera, et cetera, et cetera. It really becomes almost like a commercial property marketing opportunity. So we take that information, we send it to our municipalities, because that's where the vast majority of these properties exist. They send us their information back, and we package it back to the site selector. That will, at times, prompt a visit, and every so often, a relocation. So this particular measure talks about the number of attraction projects that we that we received. 56 here in Northern Colorado, calendar year 24. Watching my time, I would just highlight 26 of those were in heavy machinery production types of businesses, 21 in energy, 7 in IT technology related, just to kind of give you the calendar year trends. So we've had a few wins, as a collective NOCO ready. I'd love to go into deeper analysis of that when we meet in quarter 4, and I'll stop there.
Questions for Mark? Commissioner Shadegg?
I might have questions, but I think I'll wait and ask through Laura just for the interest of time, but you sparked my curiosity. Thank you.
Thank you.
Commissioner Cavallis?
Thank you. Thanks, Mark. It's not covered by these particular performance measures, but I wonder if at some point we could have information about business retention.
You bet.
What are we doing to support businesses small businesses and larger ones, primary jobs, secondary jobs,
Absolutely.
to keep them operating?
So in the fourth quarter, I have an opportunity to sit with the 3 of you in a work session on the economic development footprint, and we will make sure we cover that.
Wonderful, thank you. Yeah, and it'd be interesting as you dig into those, retention rates for employment. If you discover anything new, please share that
Right.
with us.
You bet.
It is, I'm sure there's various reasons for that happening, but yeah. Thank you.
You bet.
All right, we will move on to behavioral health.
Good afternoon, Commissioners. Amy Martonis, Service the Director of Behavioral Health for Larimer County, and I'm happy to be with you this afternoon to look at a snapshot of our key performance indicators for our department. And in doing so, and before jumping into some of our data, it's important to recognize that all of the work of our department is made possible by the taxpayers of Larimer County who care about and prioritize behavioral health by creating dedicated funding through the sales tax measure that passed in 2018, where 25 cents on every $100 is reinvested in dedicated behavioral health funding, which supports all of this work. Our first performance measure is regarding the Longview Acute Care Behavioral Health Facility. And as you can see, Longview is meeting a critical community need in the year of 2024. There being 6,659 visits to the behavioral health urgent care and serving all age ranges from 0 to over 75 years old. So that's meeting a critical and important community need. It's also important to note that that represents 3,647 unique clients, and of that, 2,860 of those clients reside in Larimer County. That's about 78%, which is important to note that both our sales tax reach is broader than Larimer County. We have folks contributing regionally and nationally to our sales tax base that funds these efforts, and it's a recognition that behavioral health care needs do not end at our borders, that's a shared experience of needing crisis behavioral health care. So we're thankful and fortunate to be able to have that facility. The clinical services that are provided at Longview are through our contracted vendor, Summit Stone Health Partners, and we appreciate the thoughtful and dedicated work their team provides in offering those services. On the bottom left, the next indicator that we'll talk about is the percentage of sales tax revenue that's spent on behavioral health services and programming. This has been a longstanding KPI for our department and reflects our commitment to the stewardship of the sales tax dollars and wanting to keep our administrative expenses low so that the max amount of dollars possible is reinvested into community efforts. And as you can see, our 2024 budget and actuals was at 95% going towards those services and programming, with only 5% of our operational budget going to administrative expenses and departmental personnel cost. Our next performance measure is regarding the Impact Fund grant program and the percentage of objectives met by our grantees. It's important to note that in 2024, the Impact Fund grant program provided $3 million of funding to 41 unique organizations across Larimer County. And this data of showing 82% of our grantees met their objectives has a little bit of narrative that's necessary to unpack that. When our grantees apply for a grant, they propose their objectives of what they're going to accomplish with the dollars invested. And as we know, when grants are implemented or services are implemented, sometimes things change. So for instance, if a grantee proposed in their application that they would serve 200 individuals with therapy sessions, and at the time of their interim or final report, they served 180 clients with more intensive needs and more therapy sessions offered to less individuals, that would be marked as not having met this objective. So it's important to note that this measure means that 82% of the objectives as they were proposed at the time of applying for a grant were achieved by the end of the reporting cycle. In our department, we also have thorough processes for working through amendments or change to grants as they unfold, and I'm happy to report that 100% of our 2024 grantees are in compliance with BHS grant administration procedures. When we look at the remaining two departmental indicators, these are community indicators that our department looks at in assessing and continuing to understand the behavioral health needs in our community. The next one is the number of suicide deaths in Larimer County. And as you look at the numbers for 2024, it's a hard number to take in to recognize we had a significant increase in suicide deaths in 2024. And recognizing each one of those numbers represents a life and families and communities impacted by tragic loss. In wanting to understand this data a little further, our team consulted with Dr. Jared Olson, who's in the room with us today, and it was helpful to zoom out at the wider data trends and look at the average across 2023 and 2024, recognizing that 2023 was an outlier in being significantly lower than anticipated, and 2024 being significantly higher. But if we look at the average, it's 72.5, which is still the lowest two-year average over a decade of data. So while this is difficult to think about for 2024 and the impact to our community, it does reflect a slightly declining trend in an ongoing way and signals to us that we have more work to do to support folks in crisis and those in need of behavioral health support. Lastly is the emergency department usage. This looks at folks, percentage of folks going to emergency rooms for primary complaints related to mental health and substance use disorders or intoxication or impairment. This is important to look at, and we like to look at it in convergence with the opening of the Longview Acute Care Facility in December of 2023, while not making any direct correlation. But we're wanting to understand the broader and complex system of how emergency services are utilized across our community and the different facilities and operations have across these trends. So we are happy to see that emergency department usage for folks primarily presenting with behavioral health or substance-related concerns is decreasing. Any questions about those measures?
Any questions? Commissioner Shaddock McNally?
Yeah, I've been wrestling with that number, and I know we were in the suicide fatality review, and they do represent a life and a family and a tragedy. So I think as we go forward, I think it's great to look at the trend, but also I think it'd be great to understand kind of the age groups or the trends there, which I know there are some that we're looking at, and how we can maybe apply that to being more well, we're being very upstream, but targeted for the Behavioral Health Policy Council, and going forward if we need to do some more interventions or more targeted response. And so I'm assuming that because you guys are talking, that maybe we're looking at that. So I'm just curious about that going forward, if the collaboration between the coroner's office and Dr. Olson's office and the ROAC and the Behavioral Health Policy Council, all of us, if there's a way that I know we're starting kind of collaborating, but how can we come together and have a conversation of maybe unpacking this all, looking for, especially with the grants, changes in cycles that we're looking at and changes. I'm just curious about that. Thank you.
Yeah, I will add that I have deep appreciation for Coroner Hanks and his team and the thoughtful and thorough work that they do in supporting families impacted by suicide and loss, as well as the efforts that they undertake to understand the broader story and collect the data, which they're sharing with teams in a de-identified way to look for those themes and trends. The Youth Mental Health Suicide Fatality Review Group has noticed that the age post-high school and young adult is a higher risk category, and collaborative efforts across organizations are underway to look at what does that mean for our prevention efforts, and sharing resources and information about services such as what's available at Longview to make sure folks know that when they're in crisis, our community cares and resources are available to extend support.
Phenomenal response. Thank you. I look forward to our continued conversations. Thank you.
Thank you, Commissioner. Commissioner Cavalls? No? Okay. Well, we are running low on time, so thank you all very much for the work that you've done throughout this year. And, this has been a great kind of summary of the work that you do. Just a little snapshot, honestly, though, of all the work that you do throughout the year. So I think that, these are great metrics, I think, already. And I think as we refine that, it'll be interesting to see, what we want to focus on. But certainly, thank you for your work. And I guess I might leave the last words to Laura Walker, our Human and Economic Health Director. She is the leader of this group, and thank you all for being here. Go ahead, Laura.
Thank you. I just wanted to acknowledge that these departments track many, many more data points, both as a form of requirements for their various funding sources, but also just their due diligence and doing the best they can for the most vulnerable people in this county. And like you said, it's a snapshot, but there's a lot more to the story, and I always appreciate the commissioner's interest in hearing more. So thank you.
Thank you. So we'll look forward to seeing you the next time, and keep up the good work, and thank you, everyone. Anything, Lorenda, from you?
Julie, each time you do this, I'm more and more impressed with all the various things the county does, and I know it's the tip of the iceberg. So I hope that folks listening know that this represents the kind of message we want you to know that we're working on. But the work goes much deeper, and certainly the heart is for this work, and the care to provide good services is here. And I think that can get lost sometimes in numbers and data, but it's important to measure things because that's how we know we're doing a good job or not. So, Julie, thank you for your work, and thank you all for the work you do every day just to piece this together and to keep us all moving.
Wonderful. And with that, it's 3:30, and we are adjourned. Thank you, everyone.